UK is looking largely on vaccines and the booster dose. They're really relying heavily on boosting their way out of this current huge Omicron wave. Other experts, including SAGE, have advised that a vaccine plus strategy could bring down the current rate of increase faster than what we're currently seeing. Omicron has a faster rate of growth than any other variant that we've seen to date.
What parallels can you draw between the UK's Omicron experience and ours here in Australia, for example, or outside the UK?
Well, what we're seeing globally in terms of Omicron is that although there is a very steep increase in cases, and that same pace is happening in Australia, as we have seen in South Africa, Denmark, and now in the US as well. So the other aspect of this, in this hairpin curve, means that we'll also come out of it much faster than with other waves. And that's surely because so many people are getting sick all at the same time that when we hit the top of that curve, it's going to come down much faster. Now, in terms of using face masks, etc., in the UK, it has become once again reintroduced into schools for children, but these are surgical masks, and the better move would be to use the FFP2 or 3 higher medical grade type of face coverings because of just the fact that Omicron is so much more transmissible. We need better quality face masks as well as better ventilation. So in the UK, we only have 7,000 filtration units that have been implemented in schools. And this is after 2 years of health experts calling for clean air policies to also ensure that there is a grading system in terms of how COVID secure various buildings are, et cetera. So this needs to be stepped up as well. In Australia, we're looking also at ensuring that multi-layer strategies are being used rather than relying on vaccination alone.
How key have rapid antigen tests or lateral flow tests in the UK been in the fight against Omicron, and have these been easily accessible? Because we're having issues right now here getting a hold of them.
In the UK, we have had rapid tests as a key part of allowing entry into various sites earlier in the Delta waves, et cetera. And until now, there has been good access. They've been available for free at every pharmacy, so widely accessible. However, due to the sheer numbers of this current wave, it is very difficult because of the testing shortages. So not only the rapid antigen tests, the lateral flow devices are stocked out at nearly all pharmacies. Also, PCR tests are being booked up. So this also means that our numbers that, of course, SAGE advisors are looking at to really just make key policy decision. We know that this is going to be an underestimate because simply of the fact that people cannot get tests at the moment. And this has been the case even before Christmas. So this is a prolonged issue. In the US, however, they're only really introducing rapid testing very recently and at a cost, which is a barrier towards use. So certainly from a public health perspective, providing free tests is a better move.
And the focus in developed countries, as you mentioned before, Boris Johnson is focusing on getting that booster shot. But what has the WHO said about this?
Well, the WHO is looking towards all countries to ensure that at least 70% of every country's population gets their first 2 doses. And in order for that to happen, we really need to ramp up not just supply, but ensure that on the ground there is logistical support in terms of transport, storage, health workforce training, and all of this is to ensure that we end up in the same scenario again with a potentially worse variant. So while boosters are critical, we do know that breakthrough infections are happening at a rate higher than with any other variant before. So we cannot just rely on 2 doses of vaccines in the same way as previously. We also need to ensure that alongside boosters, there is a bigger push towards ensuring that countries like or across Africa, for instance, only 1 in 4 healthcare workers, the people who are at highest risk of being exposed to this disease, are not fully vaccinated. And so we need to make that a priority alongside boosters. It's a really both and strategy.
And of course, many countries are looking to the UK to learn from its Omicron experience. How is the healthcare system there coping, especially with the Omicron surge and also compared to the Delta previous peak?
Well, we're still dealing with Delta. So co-circulation of Delta and Omicron are happening at the same time. So we've got a double threat. And currently, we have 67% of hospitalizations that are due to COVID, not with COVID, which is a popular narrative. So that is also putting strain, because in hospitals, as soon as you have to ensure that the COVID wards are separate to all of the other areas of the hospital. Healthcare workers themselves, 1 in 10 have been off sick, which has caused massive disruption across the NHS. And we're looking at predictions that across other workforce sectors, it could be up to 25% of people in all key industries that could be off sick as well. So now our population is better protected, but our healthcare system, particularly the NHS, which has the lowest number of ICU beds across compared to Western Europe. And we are in a worse position 2 years in terms of healthcare system resilience due to burnout of staff, dropouts, et cetera, people quitting. So there are, from that perspective, although the population is more protected with vaccines and treatments, the healthcare system itself has really been under severe pressure for 2 years, and we're facing a really record rate of increasing. Now, this has leveled off a little bit, but I don't think that signals that the peak is over, that we have peaked in London just yet.